Hi everybody, I'm going to show you how I adjust somebody's thoracic or middle back spine for patients who have pain in through the middle back. So the middle back is called your thoracic spine. It starts at the bottom of your neck and it goes to about right below your bra strap. This is the area of the spine where the ribs come out and wrap around and go around the front. So multiple things can happen in the middle back to cause you pain. Maybe you have a muscle spasm in the muscles. We did a previous video on that. Maybe your spine is out of alignment, which is how I'm going to show you we adjust the spine that way. Sometimes even rib heads that attach or become a joint with the thoracic spine can shift out of alignment too, and it can feel like a pinching pain and hurt when you take a deep breath. So all of those things can benefit with an adjustment. So I'm going to show you how I adjust the middle back spine today. So first, I'm going to just palpate around the area where I feel vertebrae are not moving well. In chiropractic, we call that a subluxation, joints that are fixated and locked and don't want to move. The table that I use is a drop table, so it lifts like this and it can drop down just like that. That's an additional way, a tool that we use to help with adjusting, so it's not so much pressure on the patient. The table's velocity of the drop actually helps with the adjustment. So here we go. I'm gonna have, Chris, you can take a breath in please for me. I'm just gonna line up where I want to adjust, and the table's gonna drop down, and there was like a nice cavitation, a nice crack, if you will, right in our middle back. And we're gonna do it up here again, and let all the air out, same thing. Excellent, nice adjustment right in through there. And then when I repalpate, I can feel that those joints are actually moving better. It's not as taut, not as locked up, and that's what's helping to take pressure off the nerves, correcting subluxations, allowing for better motion in the spine, but also function of those joints and of the nerves that exit out there. And the nerves that come from this region go to the heart, go to the lungs, go to the small intestine, go to your portions, go to your stomach. So a lot of important functions happen with the nerves in this region. If you're having middle back pain, don't wait. Come to a chiropractor, get adjusted. Come to our offices. We'll do a thorough examination, take some x-rays, and start getting it adjusted so you can start to heal and feel better without drugs and surgery and all that jazz. All right, so that's it. Thanks so much for joining us, and we'll see you again soon.